So we utilized these samples from Mayo Clinic Study of Aging and Alzheimer's Disease Research Center to assess metabolic signatures in CSF and plasma from the same individuals. And we used 3 groups of individuals with different severity, different progression of cognitive impairment of Alzheimer's disease. We looked at cognitively normal individuals, we looked at mild cognitive impairment, and Alzheimer's disease patients. And another advantage being at Mayo Clinic, we have a very well-equipped metabolomic score facility. So combining these 2 advantages, we run metabolomics in CSF and plasma to see whether we can detect changes associated with altered mitochondria function, brain energetics, and basically it was our pilot investigation in relatively small sample size. We had only 15 individuals for each group. And we were very delighted to find that A, we can really detect significant changes, even in this sample size, in CSF and plasma. And the second question that we were very interested, because if you want to really develop clinically relevant tests, you want to focus on plasma. So one of the most important questions was how metabolomic signatures in plasma correlate with signatures in CSF, in changes in CSF, because CSF most closely represent what's happening in the brain. And we found that with disease severity, plasma very accurately actually detected changes in CSF. Of course, we found that plasma also represent changes in the other organs, in periphery associated with severity of Alzheimer's disease. But actually, it very closely really represents changes in CSF. So that's, in my opinion, that is one of the most important observations of our study, validating the use of metabolomics as a potential tool to develop tests for early diagnosis of Alzheimer's disease. So right now we continue this research. So this first paper was dedicated to what we call non-targeted global approach, when we just separate metabolites in CSF and plasma and look at hundreds of metabolites. So we actually look at over 350, next to 400 different molecules. So the next step would be to take targeted approach when you can really actually identify specific molecules that are changed. We look at the pathways. So when you look at that many metabolites, you can identify affected pathways. And we were very pleased to find that indeed changes in mitochondria, changes in brain energetics, TCA cycle, Krebs cycle, and lipids were among the most affected. So we also think that that was a great observation, because we can now take the information we got from humans, go back to the animal models, and continue working, trying to identify, can we manipulate these pathways? What is happening early? So we can really get the information about the mechanisms. And now, if you can find how you can normalize the mechanism, you can come up with a cure.